Cost reduction has always been a core competency for us in supply chain at OhioHealth. However, we did have consultants come in a few years ago, and they did an organization-wide study where they targeted $30 million in drug and supply savings opportunities. Now, given our focus on physician satisfaction, quality of work life, we knew that without physician engagement, we would not be successful in hitting that target.
Well, sure, and everybody knows that's the single largest and fastest growing segment of any organizational supply expense. So the first segment of our blueprint is called Framing the Scope. And in that segment of the blueprint, one of the key components is obtaining physician input. So how did you go about getting your physicians to participate?
Well, we had to, do some things in order to prepare to engage with the physicians. So one of the things that we do first is looking at a very general sort of identifying of targets. So we pull from a number of different sources of what those targets might be. We're looking at ideas that the physicians might have. We're doing top-down reports of where we're spending large sums of money. We're going out and we're asking, other peers of what are you targeting? What are you working on? And then we start thinking about, okay, who's impacted? What sort of physician profile makes up this category? Are there certain physicians who are impacted? Are there areas that we need to be focused on or aware of as we embark on it? And then we start getting specific. So this is where we really are driving into one particular project and saying, what does that reporting look like? What's the savings opportunity? What are we going to target to save? Who are those specific physicians who will be included in this? Who are those vendors? And then we'll take a step back and we'll say, does a steering team exist for this? So are physicians already engaged? Do we have new relationships that we need to develop? And then from there, we start to develop that milestone tracker where we're going to be specific about a timeline and when do we want to accomplish this? When are we going to start? When are we going to have those first meetings?
Exactly, and we've been lucky enough at OhioHealth that we have had some physicians who have already shown us that engagement, specifically in neurosciences or in cardiovascular services, where we have come to the table for previous projects and we've been able to achieve some savings there. But we don't have that dynamic everywhere, so that's where we set down those formal steps where we'll meet with the chief medical officers or key physician leaders and ask them about effective engagement. Examples of that include us meeting with the VP of Surgical Services or the physician leader of neurosciences. And we focus on what that collaborative approach would be and how we can most effectively present that information, be clean, concise, and clear on the data that we present. And also, we want to give them perspective on the marketplace as well so that they don't think that we're being unreasonable when we're negotiating with the vendor. But at the end of the day, our goal is to all get to the table and come to agreement on a single strategy or direction moving forward.
Right, and for the purposes of what we're talking about here and for what we've really blueprinted out, is we're talking about our benchmarking strategy. And so we like to be specific in what that benchmarking strategy is. And I can talk a bit about what it is and what it's not. So what it's not, we don't compare technologies. So we're not looking across and saying item A is kind of like item B and therefore it should have the same price. We're not doing that. We're not limiting choice. And so we're not saying that we're going to remove someone from the market and therefore be able to drive better costing in one area. And we're also not seeking out the best pricing in the marketplace. So what we're really trying to do is get to that 10th percentile of pricing. And this is pricing that we're using a number of sources to pull from. So we really have 2 benchmarking databases where we're saying, what's that 10th percentile of pricing? So this is good pricing, and it's good pricing that's already in the marketplace. And we're also seeking to preserve choice. So our goal is to be able to engage people, to be able to engage those physicians, engage those vendors. And like Jen mentioned, we're making sure that we're identifying all of those physicians who could potentially be impacted.
We traveled to OhioHealth, and in addition, obviously, to having Jamie and Jennifer here, we were able to hear from some of the key stakeholders in the process they're describing. Let's take a look at what we heard while we were there.
We had a large savings target to hit in 3 years, and we knew that most of the opportunity was in the physician preference areas. So we had a $32 million target, and we knew that a large portion of that would be in physician preference type products.
We started the process with understanding what were the instrumentation sets that we were using now. We wanted to understand the practice patterns of the surgeons and see where we had opportunities perhaps to move things.
Anytime you approach a physician and you ask them to participate in an initiative, they want to see the numbers. They want to see that we're actually paying for that hip in the 65th percentile, where in Phoenix, Arizona, they're getting it for $500 less. Once we were able to show that data, they were on board. We had a series of kickoff meetings where we introduced the data to the physicians in a formal setting, and then we invited all of our sales leaders in, and we intentionally did not invite sales reps in. We wanted vice presidents or directors from the major joint suppliers.
They came in and sat down, and it was uncomfortable for them. Many of them at that level didn't really know each other. We sat down very formally and presented what we had to present, which was our logic on how we were moving forward with the contracting initiative. The fact that we were only asking them to give us the same pricing that we knew that they were already giving other large systems, in some cases even smaller customers than us. Our physicians supported it, and that what we were trying to do is preserve choice and keep them all involved and engaged.
The fact that our surgeons were there in the room, they understood that we meant business. And so we actually had a fairly good response rate. We had a few companies where the response was not where we expected it to be, and one that we were in jeopardy of having to pull the stock off the shelf. I mean, I had explained, really where the mission of our organization, where we're really trying to drive our episode of care costs down. And in order to do that, we have to be able to align our physicians into these cost containment programs. And after a while, he really got it. And he went back to his sales rep that he had a really good relationship with, and he said, hey, I'm leaving next month to go to a total joint training program because I can't use your product anymore. And next thing we knew, the phone was ringing, and all of a sudden we had some modified pricing coming back in.
It would have been, I think, tempting to say, okay, we're going to limit this to the 3 top vendors that control 80% of our current market, and then try to drive them to the best price. I mean, that would have been probably from a business standpoint much more satisfactory. But they really wanted the physicians to be a partner in solving the problem.
That we earned trust. We were not trying to change what they were doing. So they supported that, and when we got pushback from their suppliers, they pushed back with their suppliers.
The impact of this initiative has been huge for us as an organization.
But it was this past year alone, we took $14 million out of drug and supply on an annualized basis. Of that, the physician preference items represented 80%.
I do think this has been a fabulous project. I think it is only the start of the kinds of things we can do if physicians and the hospitals work together to give the best patient care, the best outcome, at the best value.
Wow, so you were actually shoulder to shoulder with your docs who were pushing back on those suppliers together.
Yes, we were, and that dynamic is instrumental to our success. But before we could get to that point, we really had to focus on forming those relationships with our physicians. I think that's the one best thing that we could do to give us, that best chance, whether it's looking toward standardization or cost reduction, is shifting that relationship away from physician vendor preference to physician and supply chain alignment. And then from there, we work on that consistent messaging, delivering it in that same format every time, reaching out to those chief medical officers, engaging with those physician steering teams, and making sure that all of those key stakeholders are notified. And and that notification doesn't always need to come from us. Sometimes that message is more effectively delivered when it comes from the right sponsor or leader. An example of that is when we walked into a meeting and we were laying out our strategy to the C-suite, and all of a sudden the room got quiet, and we had one physician leader in particular look over and say, well, who are you to deliver that message? That's my job. These are my physicians. And Jamie and I looked at each other and we said, well, you're right. Thank you. We would love for you to deliver that message, please.
Jamie and Jennifer, you know, when we were at OhioHealth, it was evident to me that the culture there is definitely an enabling one. So we've got some more tape from our day there. Let's listen again to what some of your colleagues said about culture.
Credibility is the absolute primary thing that you have to consider anytime you engage physicians and try to obtain alignment. One of the things that people want to understand, our surgeons want to understand, is that you understand what their daily lives are about. And when they are comfortable using, wearing a certain pair of pants, they don't want you to give them a different pair of pants.
We do not want to limit choice, but we would like to go to the vendors and say, we'd like to have the best price. We want to have the best pricing in the top 10%. And if you don't want to participate, then you won't be in our hospitals. It wasn't like, we're going to get rid of your instrumentation. It was, will you participate and will you support putting a little pressure on them? And they were all very supportive of that.
So with the cultural transformation, we started acting like a system. Our physicians started aligning with our strategic imperatives, our corporate objectives, and that was the foundation for us being able to be more successful in supply chain and what we had to do as far as reducing supply expense and services expense.
I think at this point, the spine surgeons throughout the system see the supply chain folks as a resource and something to be utilized for information.
It's evident in the way the physicians treat us, the respect we have for our physicians, how we treat our associates, and the engagement we have from every associate.
Once we were able to get some buy-in from one or two orthopedic surgeons who were aligned with us as medical directors, they were able to use their peer influence with their colleagues to help drive the process and develop some synergy within the group.
What was really significant to me in that was Dr. Bay saying that supply chain is viewed as a resource to the physicians at OhioHealth. I think that's quite an accomplishment.
Yeah, we agree. I think it's something for the team to be proud of, and I think it's a testament to the entire supply chain department and all of those people that we work with. So whether it's your data integrity, your contracting, building the items, our value analysis team, down to the folks who represent supply chain on a daily basis with those physicians. It's really all about that important work that helps to build the credibility and build that relationship.
Also in the blueprint documentation, Bob Boswell, your vice president of supply chain services, has said that the culture is creating the environment conducive to success. Mm-hmm. So how do you do that at OhioHealth in a large system and then at a single hospital?
That's a good comment, because at OhioHealth, work, life, and physician satisfaction really are key drivers to our staff culture. We base our performance as well as model our decisions off of a balanced scorecard where we look at those four quadrants: the quality of work, life / physician satisfaction, as well as patient satisfaction, clinical quality, and financials. And that model has been very consistent. It's been in place for a number of years and across all of the levels of the organization. So I think when you have that alignment of purpose, it doesn't really matter your size necessarily, whether you're large or small. You guys are all working toward that same goal.